Hello, everyone, and welcome to week 2, Assessment, Diagnosis, and Professional Issues. This week we'll be introduced to several assessment tools to assess for different substance and behavioral addictions. So I encourage you to take a look at all of those tools because they'll be applied differently for different situations. Several of them can be done by the clients. So they're easy, they're simple, and then they can have a conversation with you or someone else about what maybe their scores or the information they provided means. So you'll have several of those that you can take a look at. We also begin to look a little more into diagnosis with the DSM, and we talked a little bit about that in week 1, but this week you'll take a more thorough look at diagnosis and understanding how to classify different disorders by using the DSM. So one of the professional issues that we'll really address this time is the understanding of licensure and certification if you are going to specialize serving individuals who are dealing with addiction or substance use disorders. And so there's a lot of conversation and there's been a lot of movement in the field recently to provide more professional training, certification, licensure for individuals who do want to specialize in this field. However, it does not mean as the clinical mental health counselor you will not and you cannot serve this population. Like I said in the introduction, you are very likely to encounter someone who is either experiencing these symptoms or a family member who is walking alongside someone who is experiencing these symptoms. And so you will have the opportunity to take a look at your state and what are the requirements in your state if you want to focus on this population. When you begin to talk about assessment and screening, we begin to look a little bit into the specialization of addiction disorders. However, as a clinical mental health counselor and going through this master's program, you will have the foundation to begin that journey, at least for screening, and to consider the diagnosis for the clients you're working with. Often this can be really complex, and if you end up working with someone that you feel is outside of your scope of practice, whether it's addiction or anything else, you do have a professional responsibility to reach out to a clinical supervisor, have some peer supervision, really figure out what is best for that client, which may be referring out to another professional. However, that shouldn't be the first option. If you're developing a relationship with a client, you want to gather as much information that you can to really determine if you can help them meet those needs or not. Sometimes it may be that a relationship with a supervisor who's more knowledgeable may be able to walk with you and work through that with you. At other times it may be very clear that someone needs to focus on a more intense level of counseling with addiction, maybe even inpatient or a detox or some other program that you are not able to meet their needs. So I encourage you to look at the addiction counseling competencies that are included in this course, to look at licensure and certification in your area so that you know how they define what you can do in a clinical mental health setting. If you do desire to further your education and supervision to focus in this population, it helps to know that information now in case your state requires additional hours or additional requirements to obtain that certification or licensure. Another component of what we'll talk about this week is co-occurring disorders, really assessing for that. So there are a few tools. Many clients who deal with substance use disorders also have other disorders co-occurring with the substance use, whether it's anxiety, depression, trauma, we look at those and try to understand how they're related, how they're not related, understand the symptoms that kind of started, and when they started, it's a fairly complex process, one that often does rely on collaboration with many professionals, maybe a psychiatrist, a counselor, a physician, different people that need to be involved. And so these screening tools and really being able to understand the whole person and the symptoms they're dealing with is important. So we'll introduce you to some of that understanding this week. There are a few videos, the SBIRT videos. SBIRT is it's just an acronym for Screening, Brief Intervention, and Referral to Treatment. It's a really powerful model that was mostly developed for physicians in emergency settings, because they realized that in a lot of the trauma centers for hospitals, such as when a major accident happened and someone was admitted to the hospital, that a lot of those were substance induced. And so this model was to help train physicians and other staff into how do you identify if someone has a substance use disorder or problem, and that's the screening piece. How do you have a really brief conversation with them to motivate them to do something about that, without just telling them, hey, this was not a really good idea, you need to stop. That we know that that's not effective in the counseling field, and so it was to give them tools to use motivational interviewing as a core of that, and to have really, the research has shown about 10 to 15-minute conversations that significantly change the course of those patients leaving the hospital and then going and seeking help, or just that conversation alone reducing that high-risk use. And so so the counseling field has really adapted a lot of these models for trying to reach clients in a very brief setting to encourage them to do more. So you'll see a few examples of that, and a piece of that related to this week would be the screening part, is the use of tools such as the audit or the DAST to get some basic information, and use the client's words to ask more, to reflect back what's important to them, and make that encouragement to take the next step. So there's just some really neat resources that you'll be introduced to. And then I'll be back with you for week 3.